Okay, so the decubitus patient is in recumbent position and usually implies the use of horizontal plane. So to make it easier for you to understand, when we say decubitus, it refers to the horizontal source of X-ray. So di ba usually if this is the table, yung ating X-ray tube is nandito sa taas. But for example, if this is the table and this is the X-ray tube either on the left or the right portion of the table, that is a decubitus. And decubitus is a position. So for example, decubitus is a position. So for example, if this is the X-ray table, this is the left portion, the right part of the table. So the patient is lying on the table. We have here the patient. When we say left decubitus, so since this is the position, so what part of the patient is near the table? The left part or the right part?
Left.
Ano?
Right.
Right.
Right is near the table. So again, when we say decubitus, so this is a position, but it refers to the position of the X-ray tube or the source of X-ray. So when we say left decube, the patient is in supine position. Nakasupine ang patient, meaning he is lying on his back, but the X-ray tube is nasa left part ng patient. So it will pass through the left going to the right. Can you imagine or can you picture out?
Yes, ma'am.
Yes, Doc.
So nakasupine ang patient, but yung X-ray tube is nasa gilid niya because it is a decubitus. When we say, for example, right decube, right decubitus position, the patient can either be supine or prone as long as the tube is at his right. So, pwedeng nakadapa yung patient, pwedeng nakatihaya, as long as the tube is at the right portion of the patient. So, when we say, for example, anterior decubitus. So, anterior decubitus. So, ang patient naman, hindi siya nakasupine. Nakatagilid na yung patient. Nakatagilid yung patient, but nakalateral yung patient, but the X-ray tube is facing the anterior portion of the patient. So, nakatagilid siya, and then yung X-ray is nasa anterior portion and it will pass through the posterior portion. That is anterior decubitus position. So, naka-lateral ang patient. And then yung tube. So, anterior decube is the same as lateral position. Ha? Lateral position because the lateral or the side part of the patient is near the table, either left or right lateral position, but the X-ray tube is nasa anterior portion ng patient. This is anterior decube. Or if left lateral position or right lateral position, and the X-ray tube is nasa posterior portion. So this will be posterior decubitus position. Okay, so is it clear?
Yes, ma'am.
Naintindihan?
Yes, ma'am.
So another term is, let me erase this one. So another term is PA projection, which I have discussed naman kanina. So we have the PA projection. It enters the posterior and exits the anterior portion. So enter, exit. If AP projection, it enters the anterior and exits the
Superior.
posterior. Okay, very good. Another term is central ray or CR. It refers to the central beam of the X-rays. So for example, if this is the X-ray tube, these are the X-rays, the central ray is here at the center. That is the central ray. So this is a very important part that you should be familiar with during the positioning of the hand, of the skull. So you will need to remember to memorize if asa dapit ang central ray for that. So there is a different central ray for fingers, for hand, for wrist, for AP, for PA, for lateral, for oblique, there are different central rays. Sometimes central rays are also angulated. So for example, we will say 10 degrees central ray towards the uh, joint. So those are examples. But we will discuss and learn more on that na later. So I have also discussed the AP projection, the PA oblique projection. So naka-PA ang patient. So this is a projection. So it enters the posterior portion and exits the anterior pero naka-oblique ang patient. So it is also referred to as the right anterior oblique position. So pwede siyang raw position. Pwede siya low position. It depends kung what part of the patient is near the IR. If part of the patient that is near the IR is the right, so that is right anterior oblique position. If the part of the patient near the IR is left, so that is left anterior oblique position. So these two can also be referred to as the PA oblique projection. Axial projection. So your keyword for axial projection is the central ray is 10 degrees or more with the long axis of the body. For example, this is the long axis of the body. This is the head. This is the feet. So the central ray is not, as I have mentioned, is not always 90 degrees. There are times the central ray is angulated, like this one, for example, 10 degrees or 15 degrees. Basta more than 10 degrees, it is referred to as axial projection. So the patient is not rotated. Instead, the X-ray tube is being adjusted, is being angulated 10 degrees or more. So tangential, so your keyword here is skim. So parang the place. For example, again, this is the part of the patient. So sometimes we are exposing the patient from front to back, for example, or from front to back or back to front. There are times, skim lang. This is the patient. So, yung x-ray niya is here. Then, it will exit in this portion. Like, for example, sa knee or sa patella. So, this is the patella or your kneecap. So, x-rays will enter here and will pass through here. So, skimming siya. That is called tangential projection. It is the opposite of axial. Kay axial, from here, it will pass through sa other side. This is axial. Tangential will just skim siya. Okay. So, to give you a picture of what we have discussed, so we have here supine, position, AP, projection. So, AP, projection, supine, position. It enters the anterior portion and exits the posterior portion. So, here we have the PA projection. So, hindi naman siya naka-prone kasi nakatayo siya, pero nakatalikod. We have here the lateral position. So, what kind of lateral is this? Right lateral position or left lateral position?
Right.
So, right lateral position. Very good. How about projection? What kind of projection is this? Left lateral projection or right lateral projection?
Right lateral. Sana, Doc?
Left, Doc.
Ano?
Left
projection. Right.
Left
So,
lateral
left
projection.
lateral projection. Very good. Right lateral position. Okay, very good. So this one, the opposite. So we have here the, what kind of position is this?
Left. Left lateral.
Left lateral position. How about projection?
Right.
Right lateral projection.
Right.
Right
lateral.
projection. Very good. This one, the patient is neither supine nor lateral. Therefore, this is an oblique position or oblique projection. What kind of position is this? What kind of position? What kind of oblique position? Right anterior, right posterior oblique,
Left posterior oblique.
Left.
left posterior.
Left posterior oblique.
Left posterior oblique.
Good. So left posterior oblique position. How about a projection?
Right posterior oblique.
Right posterior oblique.
So left posterior oblique position. So projection is
Right.
Right.
Right posterior projection.
so when you
Right
say,
anterior.
so remember the LPO.
PA oblique.
Yes, very good. Wait. So the LPO, the RPO, the LAW, and the RAW, they are all position. So if I am asking here, for example, of the projection, this is AP. AP. So it will enter the anterior portion, will exit the posterior portion. So this is AP oblique projection. Is that clear?
Yes, Doc.
Sige. So how about this one? Yes, may question? Sige. So how about this one? What position is this? This one.
Right posterior oblique position.
Right posterior oblique position. How about the projection?
AP.
AP, Doc.
Correct. So both of these, they are AP oblique projection. Don't just say AP projection. Okay, when we say AP projection, the patient is either supine or prone. Or AP projection, the patient is supine. So we have to be specific, AP oblique projection. How about this one? What position is this?
PA. Oblique.
Position.
Right anterior.
Anterior.
Anterior. Left
Left
anterior.
anterior. Left anterior oblique position.
So this is left anterior oblique position. The left portion of the patient is near the table or IR. What projection?
PA oblique projection.
A oblique.
A
oblique
oblique
projection.
projection.
Oblique projection. Last, this one.
Right anterior oblique position.
Right anterior oblique position and projection is
PA oblique.
PA oblique
okay.
position.
PA oblique projection. So very good. Okay, so I hope familiar ka mo with those terms. So let us proceed. So next we will discuss the different radiographic planes and positions. Again, this is just review. So we have different planes. We have frontal or coronal, transverse, sagittal. So first we will discuss the coronal plane or the frontal plane. Any plane that divides the body into anterior and posterior sections or portions. So coronal. But if na-specify siya na mid-coronal, so there is a term equal. Equal anterior and equal posterior portions. Pag wala mid, so okay lang, anterior and posterior. But if my term na mid-coronal, so equal anterior and posterior. When we say mid-axillary plane, this is also a coronal plane, but it passes through the axilla. So unlike this one, sa mid-coronal plane, nag-start siya sa head, from head to foot. But with mid-axillary plane, nag-start siya sa axilla or sa underarm. And when the body and the arm is at 90 degrees of the body. So kapag naka-abduct ang arm, 90 degrees from the body. So this is a frontal plane or coronal plane from head to foot. So pag equal ang front and back or equal ang posterior and anterior, that is mid-coronal. Another one is sagittal plane. Any plane that divides the patient into right and left. So it is also referred to as the median plane. So sagittal or median plane. Again, just like sa coronal, if may word na mid, so equal, left and right. So ito siya, left and right portion. When we say parasagittal, so hindi siya nag-start sa center. Ito, if you can see the red line here, so it starts here and in this one. So hindi siya nahati yung body into equal parts or hindi siya nagsimula sa center. So nasa gilid siya, that is parasagittal. Sagittal plane that are uneven. So hindi siya sa midline unlike this one. So this is parasagittal. Mid-sagittal, directly down the midline. So midline, it's called mid-sagittal plane. Next, we have the transverse or horizontal plane. So, passing through the body at the right angle to the coronal or sagittal plane, dividing the patient into superior and inferior sections. So, superior and inferior. So, it is at right angle sa coronal or sa sagittal. So, this is the transverse. Your coronal is here, sa gilid niya, front and back. So, this is 90 degrees. Your sagittal is here, so 90 degrees man. A transverse or horizontal plane. So, pag mid-transverse or mid-horizontal, divides the body into equal superior and inferior portion. Another one is oblique plane, any plane that is not classified as coronal, sagittal, or transverse. So, hindi siya nabilong as coronal plane, sagittal plane, or transverse plane. It may be anywhere in the body and usually ginagamit ang oblique plane sa ultrasound and sa MRI. So, hindi siya common sa general x-rays. So, ito siya. So, either from here up to here. So, hindi siya coronal, hindi sagittal, hindi transverse. So, any plane. So, when we say oblique, so something that is not parallel. So, when we say parallel, these are parallel lines. Parallel lines. So, pag hindi siya parallel sa long axis of the body, that is oblique. Or obliques are also odd angles. So, hindi siya 90 degrees, hindi 180, hindi 360. So, in addition to that, we also have the base plane and the occlusal plane. So, these two planes, ginagamit siya sa skull. Term used for imaginary line between the upper and lower portion of the skull. So, para siyang sagittal, pero skull ang hinahati. Hindi yung buong body ng patient. So, transverse pala. Para siyang transverse plane. Upper and lower portion of the skull. So, specific. Occlusal plane refers to the plane involving the teeth. So, ito sa skull, ito sa teeth. So, very important siya sa mga dental x-rays. Ito siya. So, base plane divides the skull into upper or superior and inferior portion. Superior, inferior. Occlusal plane, dito siya sa teeth. So, again, you have coronal, front and back, sagittal, left and right, horizontal, superior, inferior. Oblique, any plane. That does not belong to horizontal, to coronal, and sagittal. Then we have here the anatomical body position, which is also very important. So, in medical studies, so when we say anatomical body position, we understand each other. Alam natin kung ano yung position ng patient when we talk about anatomical body position. Standing erect or erect position of the body with all anterior surfaces facing forward while the arms are down with palms forward. So, ito rin siya. So, anatomical body position. So, facing forward, then the palms are also facing forward, the arms are down, and feet are slightly apart. Actually, hindi siya naka-slight apart, pero dapat slightly apart for balance. Okay? Then sa next meeting, we will discuss the different positioning terms. Actually, again, this is just a review. So the views Yung mga supine, prone, right lateral recumbent. Actually, sige, discuss ko na lang. May time pa naman. So, positioning terms, the views used in plain radiographic images are named for the part of the body that is nearest the field. So, sinasabi ko kanina na position. Nearest the plane. For example, anterior, right lateral, left anterior oblique, which we have discussed a while ago. So, na-discuss na rin natin yung AP and PA, which are projections. Radiographic positioning is highly standardized. So, to facilitate correct interpretation. So, dapat yung mga radtech nagkakaintindihan kapag naggamit tayo ng term ng radiographic positioning term. So, when we say supine, other term for that is dorsal recumbent, or the patient is lying on his back. Prone or ventral recumbent position, patient is lying on his stomach. Right lateral recumbent, so either naka-erect siya or lying, but at right angle, which is 90 degrees through AP or PA. So, basta pag right lateral, since this is a position, so the right side of the patient is near the IR. So, near the IR or table. Recumbent is any lying position. The two supine, lying on his back, prone, lying on his stomach, right lateral recumbent, lying on his right side near the table, left lateral, lying on the left side. We have also discussed this one. So, familiar na kayo with LPO, RAO. Ito, discuss na rin natin kanina. So, this is what I'm telling you with the decubitus. So, the patient. So, what decubitus position is this? If this is the cassette, this is the cassette or the IR, and andito yung X-ray tube. What decubitus position is this?
Position, Doc.
Oh, position. Ay, di ba, decubitus is a position.
Right lateral, decubitus? Or
Right.
left?
Hindi, it's postero anterior, no, postero anterior decubitus.
Left lateral, duro, Doc.
Sige, so to review, so when we say postero-anterior, antero-posterior, this is projection. Ha? Magpares, projection. The position, isa lang. So the position, if we are talking of position alone, so the patient is in left lateral position. Okay, do you follow? Correct?
Yes, Doc.
Yes, Doc.
Left lateral position. But if we are talking about decubitus position, we are talking about the direction of the X-ray. So the X-ray is here, the IR is here, the X-ray will enter the posterior portion and will exit the anterior portion. So if I am asking about the projection, so this is PA projection, right? Correct?
Yes, Doc.
Correct, ma'am.
Yes, Doc.
Yes, Doc.
Yes, Doc.
Right posterior oblique din siya.
Right, posterior, oblique, hindi naman siya
I think
naka-oblique.
it's left posterior oblique.
Hindi siya naka-oblique.
Ay,
Decubitus,
hindi.
decubitus.
Hindi siya naka-oblique, ha?
Decubitus.
Left posterior decubitus.
So,
Right
left,
lateral.
sige. So, for example, your answer is left posterior decube. So meaning, the X-ray passes through the left posterior of the patient. So is that the case?
Hindi.
Hindi.
Right lateral.
O, pag right lateral decube, right lateral decube. So the X-ray or the central ray enters the right lateral portion of the patient.
Na, is it just posterior decubitus, ma'am?
Yes, correct. Very good. This is posterior decubitus position. Do you understand? Because it enters the posterior portion and we are talking about decubitus. So remember, always remember when we talk about decubitus, we are referring to the source of X-ray at the side of the table. So nasa side siya ng table. Okay?
Mm.
So you cannot say postero-anterior decubitus projection or position because PA, as I have said, is a projection, not a position. So kung position lang, so we have posterior decubitus position. Okay, clear na?
Yes, Doc.
Clear?
Yes, Doc.
Yes, Doc.
So to recap, so when we talk about decubitus, the central ray travels horizontal or nasa side siya ng table, either from front to back or back to front, and the purpose usually is we employ decubitus position to determine pleural effusion or the air fluid level in the lungs. So ito yung pinaka-main purpose ng decubitus position. So yung sinasabi natin kanina na posterior decube position, that is also equivalent to dorsal, this is lateral pala. Posterior decubitus position if the patient is in lateral position. As you can see, nakalateral yung patient. Meaning, when we say lateral position, the patient is lying on his side. So, lateral position. The patient is lying on his side. But if the patient is lying either supine or prone, so pag supine siya, dorsal decubitus. So nakasupine yung patient. Yes, nakasupine yung patient. So this is the ventral, the dorsal portion. This is the table. And then yung tube natin is horizontal, nasa gilid, either left or right. So, dorsal decubitus. Kapag naman naka-prone ang patient, ventral decubitus. As long as, again, remember, decubitus, horizontal ang central ray or nasa side ang X-ray tube. So, that is for decubitus. Next term is Trendelenburg. So the head is lower than the feet. The table or bed is positioned so that the patient's head is lower than the feet. So this is applied for patients, not look. This is lack. Kulang. Lack of oxygen supply to the brain. This is also recommended for patients who feel like fainting o parang mawawala ng malay. So, Trendelenburg. Para yung supply ng oxygen babalik sa head or sa brain. Siya prone. Pakita na kanina. Then we have the Trendelenburg here. Another one, we have Fowler's. Ito siya. So, semi-erect. So, Fowler's patient's head is higher than the feet. This is the opposite of Trendelenburg. Opposite of Trendelenburg. So, for patients naman na nahihirapang huminga with respiratory distress. So, left seams position. So, para siyang lateral, pero hindi naman lateral. Hindi rin siya oblique. Near lateral left anterior oblique with the top leg in front of the lower leg. So, I have picture there later. Usually, ang left seams position, so, piniperform siya or ginagawa siya if we are going to insert catheter sa anal area ng patient, especially during barium enema examination, contrast examination. Then, Trendelenburg, feet is higher than the head or the head is lower than the feet. This is Fowler's. Head is higher than the feet, and this is left seams position. So, nearly lateral. So, this lateral, left lateral oblique. So, yung kanyang right leg is on top of the left leg. So, para maganda yung visualization ng anal area and mas madali siyang mag-insert ng catheter. So, next we have the divisions of the abdominal area. We have 4 quadrants, the right upper quadrant here, the left upper quadrant, right lower quadrant, and the left lower quadrant. So that is for the 4 quadrants. We also have the 9 divisions. So the right hypochondrium here, the epigastrium, the left hypochondrium, right lateral, umbilical region, so the 9 regions, the left lateral region here, the right inguinal region, the hypogastrium, and the left inguinal region. So in the clinical setting, for example, a patient could be described as having an epigastric pain. So kapag masakit yung dito na part ng patient, we can say that the patient is experiencing from epigastric pain. Or kapag dito yung masakit, hypogastric pain. So nagkakaintindihan na yung mga medical personnel. So hindi lang pwedeng sabihin na ay masakit yung tiyan niya sa lower part. Saan banda? Maraming lower part. Okay? So sa left ba, sa right ba, sa middle ba? So very specific, especially when we talk about medical terms. Another example, if the patient is feeling discomfort in the right lower abdomen, so it could be described as having a right lower quadrant. So for example, right lower abdomen. So right lower abdomen. So sasabihin natin the patient is having a discomfort sa kanyang right lower quadrant. Okay? So kung very specific, right lower quadrant, specifically sa right inguinal region. Okay? So very specific. So I have here a video on the divisions of the stomach, of the abdominopelvic area.
Abdominal pelvic regions and abdominal quadrants. Abdominal pelvic regions were created to make it easier to locate organs and diagnose the source of abdominal pain. These regions are divided into 9 sections, which are set up like a tic-tac-toe board. Looking at the body from the anterior or front view will make right and left appear backwards. But these are named in reference to the body itself, not a viewer of the body. So now we're going to go through all 9 regions and map them out, starting with the right hypochondriac region.
So again, when we talk about the 9 regions, we are referring to the regions of the body of the patient and not yung sa side natin. So pag sinabing right, for example, right quadrant, right ng patient, hindi yung right ng viewer or right ng rad tech. Okay? So, right ng patient or left ng patient.
which is in the upper left corner. The epigastric region is in the upper center section. The left hypochondriac region is in the upper right corner. The right lumbar region is in the middle left section. The umbilical region is located in the center. The left lumbar region is in the middle right section. The right iliac region is in the lower left section. The hypogastric region is in the lower center area. And the left iliac region is in the lower right section. Many professionals prefer to use a simpler map of regions to locate organs in abdominal pain. They section the area into 4 quadrants. Again, looking at the body from the anterior view will make right and left appear backwards, but again, these are named in reference to the body itself, not the viewer of the body. These are all basic in terminology. There is the upper right quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. And that be the abdominal pelvic regions and abdominal quadrants.
Sige, so that will be the end of our discussion for this afternoon. This evening na pala, gabi na. So far, do you have questions? Do you understand what we have discussed this evening? Naintindihan ba?
Yes, Doc.
Yes, Doc.
Yes, Doc.
Sige. So sa Thursday, we will not meet, but instead, you will have your first quiz. So the coverage of the quiz is what we have discussed this evening. Okay?
Doc, sasabi lang ni mo
Sasabi lang.
sige, thank you,
So
Doc.
the quiz will be sasabi. Okay? So you are 32 ngayon. Okay, if you have no questions, so thank you very much once again and good evening.
Good evening na, ma'am.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc. Bye, Doc.
Bye, Doc.
Thank you, Doc.
Bye.
Bye, Doc.
Thank you, Doc.
Thank you, Doc.
Bye, Doc.